Now we're back in the studio with another set of guests, as Pius promised before we went on that break. And these guests this time are coming to talk to us about things that affect our well-being and our health. With me in the studio, to my far left, is Dr. Ajibola Hafiz, the consultant urologist, University of Abuja. And in the middle is Sarah Dansoko, the programs director, and they're both here for Project Pink Blue. You're welcome.
Thank you. Thank you so much.
It's a pleasure. Now, let's start with you, Mr. Hafiz. Could you tell us, what the project is all about?
Yes, Project Pink Blue is about prostate cancer screening and awareness. And it was born out of the fact that there's less awareness on prostate cancer. They have been doing a lot on breast cancer and cervical cancer. And recently, they started on the Project Pink Blue to bring prostate cancer on board. So they've started a screening program. Recently, they attempted to screen about 2,000 Nigerians all over the country in 4 states: Lagos, Enugu, Abuja. And they are also, they've started already, and they've screened about 130 patients 2 days ago, and they are still going to do another one this Saturday in Abuja. So basically, she will give more update on the program they are doing, and I just want to talk more on the prostate cancer generally, so that people will be aware about the menace of this cancer in the society.
Okay. Now, before you go into talking, about prostate cancer and all of that, tell us, Project Pink Blue, is it just centralized on prostate cancer, or the other elements that you intend to cover?
Okay. Project Pink Blue is a non-profit organization. We focus on fundraising for patients who can afford their treatment. We do awareness in different forms of cancer, like prostate cancer, cervical, and breast as well. And we provide free screening for most of our outreaches. And this time around, we realized that there is less awareness on prostate cancer. And so we launched a program called Men on Blue, in which we are set to create more awareness to our men, because we realize that men are usually careless in terms of they're taking care of themselves to some extent. So we reach out to them in different, we strategize in different forms. Like last time we were at Enugu, we did it at Opera Square, where they usually do exercise in the morning, and also in Abuja we are taking it to churches, where the religious leaders also contribute in mobilizing the church members, and for them to come out and partake in this screening. So far it is going on well, and the men are responding to treatment. And we also look out for other opportunities to do more from this. Yeah, thank you.
Yes. Okay. Now, Mr. Hafiz, would you like to shed more light on prostate cancer? What are the cases, most common cases, you've noticed? What are the things, the hindrances that most people face, and all of that? Give us an insight.
Yeah, thank you very much for that question. Prostate cancer is a very serious problem in Africa generally, the black population. We have the highest prevalence all over the world, blacks. And of course, Nigeria is not excluded from that. And it's a cancer that before you see the symptoms, by the time the patient is coming down with symptoms, it's already advanced. So it's a cancer that is when it started early, there is no symptom. So the patient don't come, they don't notice anything. So by the time they started having problems with their urine or other complication or advance from the disease, is already too late. So, and in Africa now, in Nigeria now, the most commonest cancer among men is prostate cancer. And about up to 95% of our patients come late. And when they come at that stage, there's nothing much we can do, only to just palliate it.
What's the cause of prostate cancer?
Yes, like cancer generally, there are so many. We just look at the theory, what are the position to it. Cancer simply means the cells have gone out of hand, that they are growing, not obeying the laws that control the growth of the cells in the body. So, prostate cancer, there are things that we have associated with prostate cancer. The first thing is that, okay, you are a man, because it has to be from the prostate, and also notice that black is also one of the major challenge. Then aging is also major challenge because it's a disease.
You made mention of the word plaque. Most of our viewers might get confused. If you like, shed more light.
Yes, talking about the Africans, let's put it that way.
Okay, blacks.
Yes.
Okay, it came out as plaques.
Oh, okay, sorry, blacks, the Africans. So, because, like I said, the prevalence is very high. It's because of the gene, because of there are some hormones that control the prostate growth, and it has been shown that this hormone is more in Africans, in blacks, and the age is also another predisposing factor to prostate cancer, because as you are aging, then the tendency of the malignant absorption to occur in the prostate also exists. And
Okay, so you're trying to say that there are never cases of prostate cancer in younger men?
Yes, it's not common. Most of the patients, you see, average age of prostate cancer around this environment is around 65, 68 years. But we've seen prostate cancer in patients as young as 40 years. Some studies have seen 35, but we have seen at 40 years, and also at older age group. But it's more of a disease of the elderly, around 65, 68 years. That's why you see most of the prostate cancer counting. So age is one of the physiological factors for the formation of the...
Okay, now let's go to you. Could you tell us what other measures do you put in place to attract people to come for your screening program? Like you said, people, will be reluctant, and their awareness is not there so much. So is there something extra that you do with your Men on Blue program that, makes people turn?
Okay, actually we reach out to them. We don't allow them to come to us. We reach out to them to athlete. That was when I mentioned that we went to churches to meet them at their comfort zone, and we also use the religious leader, because Nigerians, we are a bit religious.
Okay. Now, if a man comes, for your Men in Blue screening, and you find out that he has prostate cancer, what steps do you take in helping this person out?
Okay, we have a program called Patient Navigation. We usually partner with over 55 hospitals here in Abuja that are into diverse forms of cancer treatment. So we refer them to those facilities, and we get subsidy for some of their treatment. So we, as an organization, we usually source for funds from our partners and donors, but with other facilities, there is this subsidy. If they do screening for 10,000, because we refer this patient, they may decide to do it for 6,000, which is fair enough. So that is the area that we usually come in, and also, if need be, we raise funds for patients to some extent. Yes.
Okay. Now, telling us, doctor, how do they go forward when they come to the hospital? They left, the screening, center, and they're off to the hospital. What processes, will follow? Unfortunately, you made mention of the fact that, most people that come are already at the latest stage of it. So let's talk about the earlier stage where, someone goes for screening, he's aware that there's a screening Men in Blue going on, and he goes there, finds out he has, prostate cancer, and he goes through the navigation process and ends up in your hospital. Take us forward from there.
Yes, thank you very much. The reason why their program is very, very important is my first statement, that it doesn't give symptoms early. By the time you're having symptoms, it's already advanced. Most patients that comes to the hospital on their own, they come with advanced disease most of the time, except those that are aware and actually come for present themselves for screening. So this program helps us to identify these patients and pick them early. So what the program does is, first of all, at the screening center, they are enlightened about the disease, the prostate disease itself, that once it is peak early, it's curable. We can cure the disease in the country. There are people that can do the operation, either radiotherapy and the rest to do it. So at the point of screening, we counsel them and we do their PSA. PSA is a blood test just to see the likelihood of the patient having prostate cancer in the body. It's not confirmatory test. So by the time you do the PSA and it's elevated for the patient based on the age of the patient and also the size of the prostate as the case may be, then we counsel the patient that they have the risk of prostate cancer based on your PSA. So there is need to do prostate biopsy. Prostate biopsy is just a simple procedure we do in the clinic. You can do it in the clinic or in the theater, as the case may be in the hospital setting. And we just take a small pieces of the prostate tissue through the rectum and send it to the pathology. By the time we have the pathology results and confirming the patient has prostate cancer, then we now counsel the patient again, discuss the outcome of the patient results with him, and tell him the options of treatment. And also, at that point too, we also need to establish that the disease has not actually spread. So after the biopsy, the patient may still need to do some field investigation, like bone scan, like MRI or CT scan, the case may be, just to confirm that this disease is early. Once the disease is early, like I said, it can be cured. Then if the patients qualify for those that can undergo curative treatment, we give them. And there are still some people that they will still be advanced, even with this screening. And those people too, we counsel them on the disease and we manage them as the case may be, as they are bad nature. So it's, the cure is available. So, and that's one of the criteria before you go into screening exercise. Can it be cured? It can be cured once it is peak early in the country. So that's what we do basically for them.
Okay, now tell us, having started this Men Blue program, could you tell us the effectiveness thus far? Yes, you made mention of the fact that, if caught early, all of that would, but how has the turnout been so far that you started this program finally?
Okay, actually, the turnout is massive, and that's why we also plan to do another one on Saturday at All-Star Field, Nyanya, by Mopo Junction, to carry out this awareness at a location where we have a lot of crowd available already, so that we'll carry it there. The turnout is okay.
It's okay. Okay, I want to make mention of the fact that this particular screening, the one happening on Saturday, is free of charge.
Yes, it's free of charge. We call it PSA, specific prostate antigen. That's the kind of test that we will do on Saturday, and it's free of charge. So we invite all our partners in Abuja to come around and get screened. Early detection is the key to surviving cancer generally.
I don't think there's a more better way to have ended that. That is a very key one. Early detection obviously is key. Thank you so much. It's been a wonderful experience talking to you and enlightening us with the Pink Blue project. Thank you so much for coming to the studio.